Tony here from Croaky, and we're at the Aboriginal Health and Medical Research Council of New South Wales' conference in Sydney, and I'm talking to Vicki Wade, who's going to tell us who she is and in what capacity she's here, because we're going to talk about the budget and one of the presentations we've just seen.
Yeah.
So Vicki, where are you based?
Hi Maureen, and hi all Croaky world out there. I'm based in Sydney. My office is in Sydney. I'm the cultural lead for the Heart Foundation. I've got a national position, so I look after Aboriginal heart health across Australia.
And you're on the Close the Gap Steering Committee?
Yes, I'm on Close the Gap Steering Committee. We met last week, and of course everyone's buzzing around there about the upcoming budget, and a lot of Aboriginal organisations in this point in time, they're a bit sceptical about how much money they're going to receive. So there's a little bit of almost a bit of malaise out there and a bit of flatness. I describe it as a flatness, as people are really worried. Probably the most I've seen people worry about budgets in the Aboriginal affairs for many, many years.
And why is that? Is that in the wake of the Indigenous advancement strategy and some of the issues we saw with that? Can you just sort of map that out?
Yeah, that was definitely mentioned at the Close the Gap Steering Committee, and the concern how the Indigenous advancement strategies method of people putting in proposals to seek funding, and also how a lot of the money went to non-Aboriginal communities. And just by learning a report this morning in here from Dr. Megan Campbell, that AHMRC have done this fantastic report. It's based on a pretty comprehensive literature review on around how Aboriginal community control health services contribute to closing the gap. And the report really highlighted to me particularly that funding does actually need to be directed into Aboriginal community control. There was a report from overseas, and I think it was Canada, that clearly shown that suicide rates had dropped by Aboriginal community control having the funding, and then also having the ability to be able to know what to do. We've said for many, many years that Aboriginal people know what's best to do for Aboriginal communities.
And do you think that report that's called, it's on the AHMRC website, but who would you say that that's very useful for?
Oh look, Megan, I think it's useful for many layers. I would certainly be highlighting it to Close the Gap Steering Committee. We did have a little bit of conversation around funding being directed to Aboriginal community controls, and not just this sort of piecemeal offering they're giving about trickling funds out. And there's a lot of Aboriginal people in positions that they're not sure that they're going to be here in next financial year, so it really is upsetting the whole workforce. I think it's aimed at many levels. Certainly it could be aimed at politicians, and that's state and federal politics. It could be aimed at Aboriginal community control. AMSs, if they're wanting to seek funding, they're able to quote some of the stuff in the report. Because quite clearly, one of the things in the report that I thought was really good was that not only is Aboriginal people benefiting holistically from going to an AMS, but the AMS is actually contributing to the overall health of everyone, and that means not just AMS staff, but those in a local district, hospitals, plus primary health network. If you've got great partnerships and you've got good advocacy happening, a bit of agitation, but with all the sort of collaboration that by AMSs being active, patients going in, our community, our mob going into AMSs, this can benefit the broader health system, and I thought that was a really good point. And that's the first time I've heard that point.
It was really interesting. It was the idea of it not only being a really best practice model of comprehensive primary health service, but one of the few that there is.
That's right, yeah. And as the report highlighted, and Sandra Bailey, as we know Sandra, the CEO from AHMRC, quite clearly said that AMSs, they've been around for 45 years now. So in that 45 years, we've learned a lot. We've learned a lot of what works.
But how would you say how much governments actually appreciate the evidence of what you do?
I don't think I don't think government appreciate it. We've been asking for government to come out to locally based community service to see exactly what's happening. I think, like, we've got Pat Dodson, who got sworn in to the Senate. Wore his Akubra hat, but he did take it off when he sat down. But unfortunately, that captured the media, and not that. We've got a father of reconciliation, a very good advocate for the mob. And I think if we have more people, more of our mob in politics, and who can influence government at that level, we might get some traction. At the moment, I don't believe government really understand fully what's happening out at the grassroots level.
And one more question before you duck off and get a well-deserved cup of tea. You're presenting next.
Yes.
What are you presenting on?
Yeah, we've got this fantastic little workshop where we're basing it on a World Cafe style, but we're calling it World Cafe Aboriginal style, where I've got some virtual campfires. We're discussing acute rheumatic fever and rheumatic heart disease, which is really the #1 killer of our babies, and we've called it that we want to bury the disease and not our babies. So we'll be having a really hands-on workshop where we hope that people feel unthreatened. It's a nice environment to sort of create some dialogue and a little bit of way forward in acute rheumatic fever, rheumatic heart disease.
Thank you so much, Vicki.
Yep, thank you.